Welcome to the Nature's Variety Obesity in Dogs and Cats Demystified webinar, the third in the Nature's Variety Demystified webinar series. I'm Russ Case, and the goal of today's webinar is to provide crucial details about obesity in pet cats and dogs. Pet parents will learn how to determine if their pets are obese and the best approaches to correcting a pet's weight problem if one exists. Veterinarians, too, should find the webinar helpful, whether it is introducing them to new ideas or serving as a refresher course on the subject of dog and cat obesity. Before I introduce our speaker, let's learn a little about Nature's Variety. Nature's Variety Pet Foods began in Nebraska about 10 years ago when the company began offering raw frozen diets. Kibble and canned foods soon followed as Nature's Variety continued to expand its selection of natural and holistic pet foods. The company's goal is simple: to empower pet parents to enhance their pets' health and longevity. To do this, Nature's Variety dry, canned, and raw frozen diets are developed by the company's research and development team working with leading pet nutritionists. Now, let's take a quick look at today's agenda. First, I'll talk a bit about today's presenter, Dr. Robert Silver. Dr. Silver will then help you to determine whether your pet is obese or not. He will reveal common causes of obesity as well as provide solutions that will help you better care for your pets. During the webinar, you are encouraged to submit questions for Dr. Silver. We'll finish up with a Q&A, and Dr. Silver will answer as many of your questions as time allows. And be sure to stick around until the very end, because after the Q&A, one lucky webinar registrant will be chosen to receive a special prize from Nature's Variety. So who is Dr. Silver? Well, let me tell you a bit about him. Dr. Robert Silver is a veterinarian in Boulder, Colorado. He's a graduate of Colorado State University's College of Veterinary Medicine with a BS in Animal Science as well as a predoctoral master's degree in cardiopulmonary physiology from CSU. A frequent lecturer both in the U.S. and abroad, Dr. Silver speaks frequently about natural medicine and treatment protocols for diseases such as cancer, diabetes, and allergies. Dr. Silver is also a self-described labaholic, and he loves spending time with his 10-year-old lab rescue, Trigger. Okay, I'm going to let the man himself take over now, so take it away, Dr. Silver.
Thank you, Russ. Thank you very much. As a veterinarian who's been in small animal practice for over 30 years, I know the single most valuable and important health benefit that you can give to your beloved critters is the gift of a healthy, natural diet. Today, I'd like to spend some time with you all to help you better understand the nutritional principles that are the foundation of a healthy and natural diet to maintain a healthy body weight. Feeding high-quality nutrition appropriately will help to create optimal health in your canine companions. But, you might be puzzled by all of these different and sometimes conflicting information that you read and hear about what is the perfect diet and how much of it to feed your four-legged friends. By the end of this webinar today, you will be much more knowledgeable about weight management in your pets and will have some simple tools that you can use to help your pets lose their unnecessary pounds. I'd like to offer a hearty welcome to all of the pet parents and to our veterinarian friends who are online today. These webinars that have been sponsored by Nature's Variety Pet Foods have been designed to help you understand pet nutrition better. We've also, in past webinars, discussed the health benefits of feeding high-quality pet foods and raw diets. In this webinar, you will learn a few new tricks for keeping your pets healthy by keeping their weight under control. And for you veterinarians, these are techniques that have worked well for me over the 30 years that I've been in small animal practice, in counseling my clients and guiding them on weight loss in their pets. When we look at these photos of this morbidly obese dog and morbidly obese cat, we sort of chuckle to ourselves because they look so odd. But these pets are actually really sick. Their disease, obesity. A recent study by the Association for Pet Obesity Prevention found that 54% of dogs and cats in the United States are overweight or obese, and obese is defined as extremely overweight. This means that at least 93 million U.S. cats and dogs are carrying way too much weight around the house. Of those 93 million fat pets, 36 million of them are so overweight they are considered obese. These numbers are pretty evenly distributed between dogs and cats. This is what has been termed the pet obesity obesity epidemic. When people say that pets and their people look alike, it certainly is true, at least in terms of their silhouette. Human obesity trends mirror those of our pets. A national survey conducted last year in 2010 by the United States CDC, the United States Centers for Disease Control, found that 33.8% of U.S. adults are obese. The same survey of humans also found that 34% of U.S. adults are overweight. These people were not included in the figure for U.S. obesity, so what this means is that 68%, two-thirds of all U.S. adults aged 20 years or older are either overweight or obese. This is compared to 20% of our dogs and 22% of our cats who have been found to be obese in the 2010 study mentioned in the previous slide by the Association for Pet Obesity Prevention. These are scary figures. That is why there has been so much media coverage of this human obesity epidemic. People are just as susceptible to the same medical problems associated with being overweight or obese as are their pets. Overweight and obese pets aren't just heavy. They're not healthy. When the body contains too much fatty tissue, the fat itself becomes a source of inflammation, which can lead to diseases such as insulin resistance, type 2 diabetes, high blood pressure, heart and lung diseases, kidney disease, and cancers, and most especially for overweight individuals, those that occur in the abdominal cavity. And there are many other diseases as well. The list of diseases in the previous slide doesn't include the problems that arise from carrying too much weight around because of the pet's overweight condition. The forces of gravity bearing upon the tendons, ligaments, and joints will create a number of problems with musculoskeletal tissue, as well as leave the dog or cat more susceptible to injuries. Problems in fat pets due to the increased weight of the animal include osteoarthritis, which is bony arthritis, cranial cruciate injury, which is a sprain or a tear in the large tendon in the knee. This is the same injury common in football players and often will occur while a dog is running uphill. Bicipital tendinitis is a sprain of a tendon in the shoulder of dogs, the second most common cause of limping on the front leg. It is caused by excessive activity, especially when running uphill or upstairs. Hip dysplasia, as many of us have heard this word, is a malformation of the hip joint. It's inherited from the dog's parents, but also has nutritional causes, as we learned in the last webinar when I discussed feeding the large breed puppy. Back problems refer to the arthritis that occurs in the vertebral column, usually in the low back or lumbar area. Carrying excessive weight will contribute to this painful problem as well as excessive activity over time. And finally, spinal cord problems occur when the intervertebral disc ruptures, causing neurologic problems such as weakness or even paralysis. It can also be quite painful. Emergency surgery may be necessary to restore neurologic function to the spinal cord to allow the pet to be able to walk again. So, what causes a pet to become overweight? They certainly aren't born that way. Well, I don't think I've ever seen a pet open the refrigerator and serve itself a meal. Have you? Well, I mean, wait a second. I have seen those YouTube videos of dogs that have been trained to open the refrigerator and bring their human guardian a cold beer, but, that's not quite the same. You can summarize the cause of overweight and obese pets in a single word: humans. We are feeding our pets too much food, and we are exercising them way too little. And if the previous statistics I shared with you about the human obesity epidemic are true, it looks like humans are also eating way too much and exercising way too little. So how do you know if your pet is overweight or obese? Well, this is a good question. You're obviously tuning into this webinar because you have a concern about your pet's weight, or you want to learn more about how to keep your pet at a healthy weight. So I'd like to offer some simple guidelines and illustrative pictures for you to use on your own pet to determine whether they too are part of this pet obesity epidemic. Once you've determined if your pets are members of this elite group of corpulent critters, we will then cover what you can do about it in very specific terms. Overweight or obese pets don't just weigh more than they should. They also look overweight in certain specific ways that I will teach you in the next few slides. By using this system I'm about to show you, it will be easy to determine objectively if your pet is overweight, obese, or is fit as a fiddle. Let me describe to you this system that has been developed by veterinary nutritionists to numerically assess the body condition of pets. This system is called Body Condition Scoring, or BCS. Although weight certainly is important to measure as an estimate of obesity, the BCS is much more specific about estimating the degree of obesity in a pet, or to what degree the pet is underweight or is a normal weight. The BCS system uses a 5 or a 9-point scale to describe how the animal's weight fits on its frame. The 5-point BCS scale will be used today for purposes of illustration. You might be surprised to learn that what you think looks to be a healthy dog or cat is actually overweight or possibly even obese. Let me start with the first score, BCS score 1 out of 5. We always tell you which scoring system we're using, and that's why this is a 5-point system. This animal is very unhealthy. It has an unhealthy weight. It is very, very thin. You can see this animal coming, in fact, because from a distance you can see the bony protrusions of their hips, their backbone, and their ribs, easily seen at a distance. They've lost their muscle mass. There's no observable body fat. They're emaciated. They're bony. They're starved in appearance. They actually are starved. They need food. They probably need medical attention. The second BCS score, 2 out of 5, is a thin weight. For certain dogs, like large breed-growing puppies, it's good. We want them to be this to help prevent developmental bone defects. In dogs and cats, we're going to see that the ribs, the spine, and other bones are easily felt with very little, if any, fat covering them. But the bones are not as prominent as a BCS of 1 out of 5. These pets have an obvious waist when viewed from above and an abdominal tuck. They're thin, they're slim, they're lean. But you know, depending upon the breed, this BCS may be normal or it may not be. For instance, I don't think I've ever seen a healthy adult Labrador with a BCS of 2 out of 5. But I have seen healthy greyhounds with a BCS of 2 out of 5. So if you have any questions about your pet specifically, ask your veterinarian, and I'm sure they can help you. The third score, 3 out of 5, this is a healthy weight. This is what we're striving for. This is the ideal weight. So in dogs and cats, you're going to find that the ribs and the spine are easily felt but not seen. And you can feel a thin layer of fat over the rib cage and hips, but you can still feel the bones underneath, just not really prominent. There's a waist when viewed from above. The abdomen is raised and not sagging when viewed from the side. These are normal animals. This is ideal, and oftentimes they're quite muscular in appearance. Now we're getting into something we can sink our teeth in. BCS score 4 out of 5. These animals are definitely overweight. If you look at that photograph of that yellow lab, you can't see the ribs at all. You can see that the tummy is hanging down, and if you looked at it from the top, you wouldn't be able to see the waist. The ribs and the spine are hard to feel, and they have a heavy fat cover. Oftentimes, the waist is distended and may even be pear-shaped when you view it from above. The abdomen sags. These guys have pot bellies or beer bellies when seen from the side, and there are fat deposits on the hips, on the base of tail, and the chest, and cats will show their weight gain in a moderate to prominent abdominal fat pad. These animals are overweight. They're heavy, they're husky, they're stout, and they need to lose weight. This last category, a BCS score of 5 out of 5, these guys are obese. very definitely. And in fact, when you look at this picture of the dog in the upper photograph, at first I thought it was a basset hound, but actually it's a beagle, I think. I mean, that's sad that it has so much weight on it. Look at the sad expression in its eyes. And, oh my goodness, look at that kitty cat. These animals are ill and they need help. The ribs are not palpable even with deep palpation. You just can't feel any bones in there. The abdomen is sagging prominently, absolutely no waist when viewed from above. And both the chest and the abdomen appear swollen or distended. And cats, their skirts, that extensive abdominal fat deposits, hang down almost touching the floor. These are obese animals. So the first thing that we need to do in addressing weight management in our pets is to, once we've identified that they are overweight or obese, is to estimate what weight they should be at ideally. Here I've given you a chart of average weights for dogs and cats by breed. These weights are only estimates, remember that, of their average weight. And remember, if your dog is a mixed breed, even though it looks like one breed or another, these ideal weights may not apply. One way to figure out your pet's ideal body weight is to look back at records of your pet's weight over the years and see what their weight was when they had just entered adulthood at maybe 2 to 3 years of age. Usually, this weight represents their ideal body weight. You can also ask your veterinarian to help you with this. You know, that's what we do. So great. Now you have a better idea of how to figure out whether your pet needs to enroll in doggy or kitty Weight Watchers. Now, the next question is, how do we bring their weight and size down to a normal, healthy level to achieve their ideal body weight? Well, once we've got your pet's ideal weight, we can then figure out how many calories to feed your pet so they will achieve and maintain this weight goal. Obviously, if your pet has a problem, it's going to be fewer calories than you are feeding now. First, I need to mention that weight loss is simply a matter of arithmetic. You want the calories consumed by your pet to be less than the calories they use up. So the equation for weight loss is when you subtract the calories from metabolism and activity from the calories from food, you get a negative number. Negative because we want weight loss. And for weight gain, it's the opposite. We have a positive number when you subtract the calories from metabolism and activity from the calories from food. So to lose weight, we need to reduce the total number of calories consumed daily in the food. Or we need to increase the amount of your pet's daily activity to increase the number of calories it burns off. Or we need to do both at the same time. In some cases, with mild weight gain, just increasing activity levels is enough to bring the weight down to an ideal level. In other cases, by just reducing the food intake a little, one way is to cut back on treats, for instance, you can achieve an ideal weight. Here is a simple way, using simple math, that allows us to compute the number of calories your pet needs to lose weight. First, you take your pet's ideal weight in pounds and convert the pounds to kilograms by dividing the number of pounds by 2.2. In this example, the ideal weight of this dog is 45 pounds, or 20.45 kilograms. Well, then we take that number of kilograms and we multiply it by 30. So here you have the 20.45 kilograms, which is the 45 pounds weight in kilograms, multiplied by 30. That gives us a number of 613.5. We then add 70 to the number that we're calculating, and that will give us the number of calories your pet needs when it's not being active. This is called the RER, or resting energy requirement. In this example, the RER is 683.5 kilocalories. This RER resting energy requirement has been established by the American College of Veterinary Nutrition as a standard for an animal's basic minimal energy requirements. For some pets where they are not able to burn calories through activity, especially indoor cats and lazy dogs, or dogs that have injuries, you can multiply this RER you've just computed by 0.75 to get an even more reduced number of calories needed for weight loss in these inactive pets. Most of the time, though, feeding your pet its RER calorie amount and increasing its activity levels will allow your pet to lose its excess weight gradually over a period of several months. So, now we know the upper end of how many calories to feed your pet to achieve its ideal weight. Next, you need to figure out precisely how many calories are contained in all of the food materials that your pet consumes in a 24-hour period. This includes treats, regular meals, table food, and snacks. Everything needs to be included in this total. Everything. Compare the number of calories you have been feeding with the number of calories your pet needs to consume to lose weight and really to achieve and maintain its ideal weight. And you can probably see why your pet has become overweight. Too many calories. Calories consumed are usually more than the calories needed to maintain ideal weight. If that isn't the case, there may be a problem, such as thyroid disease or Cushing's disease, or else your pet is sneaking some food from another source that you haven't discovered yet. Sometimes your pet may have some underlying medical condition that is contributing to its obesity. If this is the case, it is highly recommended that you seek the advice of a veterinarian to ensure a safe and effective weight loss process for your pet. Try to feed only those food items for which you know exactly how many calories it contains. Treats are some of the worst influences on maintaining a healthy weight. Many treats do not state on the packages how many calories are in each unit treat. Try to purchase, for purposes of this weight loss program, only those treats and foods that give you full disclosure of the number of calories they contain per serving. If you change to a different diet from the same manufacturer, don't assume that it has the same calories in it as the diet you have been feeding. Be a good pet parent and read the label and see how many calories you need to feed. Be sure to measure everything accurately using a kitchen measuring cup. It's easy to make mistakes and feed more food than you should simply by feeding a rounded measurement versus a flat measurement. And if you have a multiple pet household, then there's a lot of opportunity for your pet to cheat on its diet by sneaking food from one of the other bowls that are out. If you gang feed all from the same huge bowl, that practice will just have to stop. Feeding that way makes it impossible to control your pet's caloric intake. In these cases, you must feed your overweight pet separately and take up the bowls of uneaten food of the other pets so your chubby pet doesn't take advantage of that opportunity to ingest more calories either. Overweight pets usually like to eat. Eating is a pleasure for them, and by restricting the amount of food you're feeding them, you are also reducing that pleasure for them. Many times, overweight pets can be emotionally needy as well, and the act of feeding them food also feeds their emotional needs. For both of these reasons, I have found that when I feed my overweight pets 3 or 4 times daily, it helps them to feel good about being fed, even if it's a smaller meal. I don't think pets know how to quantitatively measure and compare amounts of food being fed from one feeding to another. Feeding multiple times during the day helps needy pets to feel more loved and connected to their human guardian, and vice versa as well. Feeding fewer calories will definitely help your pet lose weight. Another trick that will help with weight loss is looking at the nutritional profile of the food. This is especially true for cats whose metabolism is specifically designed to derive its calories from protein. This trick will also help with weight loss in dogs. Feeding a diet that has more of its calories derived from protein sources will help with weight reduction. Higher protein intake creates a sense of satiety, which is when you feel full and your appetite is satisfied. This reduces the perception of hunger by the pet and reduces begging behavior. Higher protein intake will also help to maintain lean protein mass when the total amount of nutrients are being reduced by feeding less food during the weight loss period. By feeding less food, your pet will be getting fewer of the vitamins and minerals that would normally be fed to meet your pet's nutritional requirements. It is a good idea to add a multivitamin, multimineral supplement to your pet's daily regimen to help supply your pet with important nutrients it may be getting less of during the weight loss period. And as mentioned in a previous slide, if your pet has problems handling protein, then this feeding strategy, it may not work. So it's best to discuss this with your veterinarian. In some cases, with mild weight gains, just increasing activity levels is enough to bring the weight down to an ideal level. In other cases, by just reducing the food intake a little, one way is to cut back on treats, for instance. You can achieve an ideal weight. But in most cases, and especially for the obese pet, we need to do both. We need to reduce the calories ingested. We need to increase the calories expended to create your pet's ideal weight. So let's talk about exercise as another tool to use to help with weight reduction. Activity does more than simply burn off calories, although calorie burning will certainly help with weight loss. Regular, moderate amounts of daily aerobic exercise also will help to raise your pet's metabolic rate, thus increasing its internal burning of calories, and thus will hasten your pet's return to its healthy weight. The question, though, is how much activity is good and how much activity can be harmful. For dogs, this can be easier than with cats, simply because dogs are leash trained, hopefully, to go on walks. So at least for dogs, we can use a daily walk as an activity to help accelerate weight loss. If your dog has arthritis or some other musculoskeletal condition that causes it pain from too much activity, then it is important to take its increased activity levels slowly. If your pet injures itself while it is exercising to lose weight, you will have to discontinue the activity for a while during its recovery, and this will definitely slow down its rate of weight loss. So it's important to walk your dog at a pace that's quicker than its leisurely sniff and stop walking routine. We need to generate elevated heart rates to sustain aerobic activity. So walk briskly with your dog, especially on the out leg of your walk. Keep your leash held closely to keep your dog under control and from stopping and sniffing. On the back leg of your walk, you can relax a bit and allow your pet more time to stop and check out the ambient scents. Be firm, but if your pet absolutely refuses to keep up with you, it would be wise to take your pet to the vet to be sure there are no medical problems that are keeping them back. If your dog has musculoskeletal issues, it would be best to consult with your veterinarian. Your vet may put your pet on joint health supplements and or pharmaceuticals, which can help with improving your pet's activity levels. But it's a catch-22, isn't it? Your dog's having mobility problems due at least in part to its obesity, but you can't reduce the obesity unless you get your pet moving. So what do? Well, the answer is to take it slowly. Gradual weight loss and gradual return to activity are needed here so as to slowly adapt your pet to more activity and less food. Slow, steady, and consistent. These are the watchwords for weight loss and activity in your overweight and obese animals. As compared to dogs, getting your cats to exercise is an entirely different matter. Indoor cats in particular have more trouble losing weight than outdoor cats. Nonetheless, here are some tricks that might help. 1. Make them work for their food. Put their food bowl somewhere that takes some energy for them to get to it. By keeping it next to their bed, you're not promoting any activity at all. Use play toys to stimulate your kitty to be more active. For instance, a feather on a long rod can induce them to chase it around, as in this picture here. Some cats like to play fetch. Keep on throwing it out there to increase their activity levels. Like dogs, Some cats may have arthritis or other medical conditions that maintain their weight or keep them from activity. Visit your vet who can help figure this out. And perhaps your cat needs some supplements for joint health. So, let me offer you some final thoughts. In this webinar, we have discovered that being overweight, and especially being obese, presents very definite health hazards. And losing that weight creates very definite health benefits. So how do you get your pet to shed its pounds? 1, be aware of the amount of calories your pet needs to ingest in a day to maintain its RER. Compare that number of calories to the number of calories being taken in by your pet in its food, its treats, and its supplements. 3, make sure that you are feeding fewer calories than your pet is expending. And 4, to do this, increase your pet's daily amount of activity, but in a slow and gradual way so as to avoid injuries. These simple steps will, over time, allow your pet to lose its excessive weight. This weight loss will help it to regain its health and positively contribute to its longevity. And this advice is based on scientific research. In a 15-year study of longevity in dogs, it was found that dogs who maintain a lean and healthy body weight, a BCS of 3 out of 5, will live on average 2 years longer. Now that's a goal worth achieving, increasing the length of your pet's lives as well as improving the quality of that life. Okay, time for the questions. Let me turn it over now to Russ.
Thanks, Dr. Silver, and we're going to get right into the Q&A, and here is the first question. I've noticed that after a male dog is neutered, and even on a strict diet and activity schedule, he can gain weight. What can I do to help prevent or lose this extra weight gain in a neutered male?
Well, it's normal for a dog, once you neuter them and remove that testosterone, for their metabolism to go a little bit lower. And so we need to reduce the amount of calories and maintain and even increase the amount of activity and exercise that they're receiving. And using the tools that I've just given you today, it gives you a very real way for you to assess accurately just how much food you should be feeding.
Okay, next question. I have a 9-year-old Sheltie that weighs 45 pounds. The vet said she is about 12 pounds overweight. Is that true?
Well, if the vet says that, it probably is. There are some Shelties who are big, but 45 pounds is generally a pretty heavy weight for a Sheltie. I would say, why don't you take the tools that I've taught you today about assessing the BCS of your Sheltie and find out, in fact, if it is in a BCS of 4 or a BCS of 5, and then use the tools I've given you to help reduce its weight further.
Okay. Both my dogs are in agility training at least 3 times a week. My Border Collie is in great shape, but my Papillon is a little heavy. I feed her half weight control and half regular food. On training nights, she gets half of her usual amount of food because she gets a lot of treats during the training. Should I feed her all weight control?
I think I don't know the specifics, of your animals, so I'm just kind of talking as best I can from the question. But it sounds to me like, with your chubby little Papillon, that feeding all of the weight control formula is probably the better way to go. And in fact, instead of giving treats that contain a lot of calories, you can use some of the kibbles from the weight control formula to use as training treats for your Papillon.
Okay. I've noticed that many Labrador retrievers become very heavy after reaching about 6 years of age. What can be done to help these wonderful dogs stay fit? Most love to chase balls, but some struggle because of their weight.
Well, we all know how famous the Labs are for their appetite. I know Labs. And you really need to feed them less. Feed them less from the very beginning. I have Labs that are 6, 7, 8, 9, 10, and 11 that all have a BCS of 3. So it's a matter of really reducing the amount of food and also withstanding the torture of their brown eyes as they beg you for more.
Okay. Next question. I cannot get my dog to do anything without a treat. He will not eat nutritional treats. All he wants to do is chew on his rawhide and eat dog snacks. How can I get him to accept a more nutritious diet?
Well, it sounds like you've been using treats inappropriately from the very beginning. Treats should be reward for appropriate behavior, not a bribe for them to behave properly. And now you've got a dog who's just eating treats and not eating regular food. You may need to speak to your veterinarian to help you with this. But my suggestion would be, and you don't want to starve the dog, but my suggestion would be to find a good quality diet like Nature's Variety and give it the kibbles from the diet as a treat, just as I had suggested with the Papillon before. This will help to adapt him to eating his regular nutritious diet each day.
Okay. My dog was a stray that we adopted. At first we gave her table scraps, though not anymore, but she's still very fat. What can I do to help her lose weight? We have another dog that is at a good weight, but I can't afford to buy 2 types of dog food.
Well, you don't really need to use 2 different types of dog food. If you go ahead and assess your dog's BCS, its body condition score, as I've described, and then figure out how many calories it needs to maintain an ideal body weight, and then just simply feed those many calories of the food that you're also feeding to your other animal, your other dog, remembering to give it a multivitamin formula at the same time, I think you'll be okay doing it that way.
Okay. My dog gets just over 1,500 calories a day and has lost 15 pounds since last December. According to his vet, he still has more to lose. Should we continue at this calorie level until he's at his ideal weight, or should we bump it up just a bit? I don't want to starve him or make him lose weight too quickly.
Well, first of all, congratulations on the weight loss. That's great. And from the number of calories your dog needs on a daily basis, it must be quite large, definitely larger than 90 pounds, probably close to 100 in terms of its ideal weight. I would trust your vet that they know what's best, that this weight loss is safe for your animal, and I would stay the course. Keep going. Get that dog down to a healthy BCS of 3 out of 5.
Okay. I'm trying to get my 8-year-old pit bull to lose weight. She's had 2 heartworm treatments and was spayed. She just can't seem to lose the extra weight. What can I do without further cutting back on the amount of food I'm giving her? I already feel like I'm starving her.
Well, you're not starving her, but you're going to have to be tough, tough love, because in order to get them to lose weight, you're going to have to feed them even less. Use the guidelines that I've given you earlier in this webinar to compute, what the RER number of calories is for your pit bull, and you may be surprised to see that you are still feeding more than that amount.
Okay, next question. My cat is 2 years old. He has a low-hanging skirt. However, he doesn't seem to be overweight. What causes the low hang?
Well, the low-hanging skirt usually is a sign of overweight. Oftentimes, we might expect to have their fat around their rib cages or over their hips, and many times it tends to aggregate down there in that abdominal fat pad. Different cats are different in terms of where their fat accumulates. But I would apply the same principles that we've done here today to BCS on your kitty cat and see how the amount of calories that you're feeding it compares to the amount of calories it needs for its RER, and it might be an eye-opener for you.
Okay. Are there fewer calories in raw food than kibble?
Well, there are. The nice thing about raw food, this is a good question. The nice thing about raw food is that it has a lot of water in it. And so your animal consumes the raw food and gets to feel full, even though it's not getting the same number of calories per unit volume of a dry kibble. Kibbles are only 10% moisture, whereas a raw diet might be 60 or 70% moisture, or even more. So you really need to define what volume or what weight you're comparing the kibble to the raw to. But in general, raw is going to have less calories, and I have found that feeding the raw diet really has facilitated my weight loss programs in my patients.
Okay. Where does hydration come in? The dog needs 1 to 3 ounces daily per pound of weight. As a successful Weight Watcher, I drank water, and more water. So I do strongly believe before, during, and after exercise, water should be used, including before a meal. What do you think?
Well, I think that that's a good idea if you can make your dog drink. As they say, you can lead a dog to water, but you can't make him drink. Water definitely does facilitate in a biochemical way the burning up of fat, but if you can't force your dog to drink the water, another solution might be to adding extra water to the kibble.
Okay. When looking at food and treats, is it better to look at the fat content or total calories?
Well, you need to look at the total calories that it contains. The fat content is something that we do with humans in terms of obesity, but animals have different requirements for fat than people do. So it's best to look at the total caloric content of the treat that you're giving.
Okay. My boxer has heart disease. On medication, what would be the best diet for him? He is 7 years old and in perfect condition and weight for now.
Well, that's a difficult question to answer in this context, but depending on what level of heart disease your boxer has, we may want to feed a diet that is relatively lower in salt. This is a question really needs to be answered for you by your veterinarian because there are so many variables involved with it.
Okay, well, I'm afraid that's all the time we have for questions. Thanks to everyone who submitted one for Dr. Silver, and I apologize if we didn't have time to get to yours. Now, as promised, it's time for our special giveaway. One lucky person has been chosen to receive coupons good for 12 free bags of their choice of Nature's Variety Instinct, Raw, or Prairie diets. And the lucky person is Willie S. from Elgin, Illinois. Congratulations, Willie S. This concludes the Nature's Variety Obesity and Dogs and Cats Demystified webinar. Thank you to everyone who joined us, and thanks to Dr. Robert Silver for teaching us about this important topic. An on-demand version of this webinar will be available online at dogchannel.com in 1 week. Remember, too, that the previous 2 Nature's Variety webinars, Raw Diets Demystified and Dog Nutrition Demystified, are also available on Dog Channel. Be sure to watch those, too. Thanks again for tuning in. Goodbye, everybody.
Bye.